everyone, and a warm welcome to the School of Health Sciences presentation today at the University's Open Day. My name is Arlene Boyle. I'm one of the lecturers in adult nursing at the university. I'm also one of the admissions tutors for our school. And in my role as an admissions tutor, I coordinate the recruitment of the new student intake each year. Now, hopefully joining us very shortly will be Kirsty Dalrymple, who is one of my colleagues in admissions, but unfortunately Kirsty seems to be having IT problems at the moment, so she's not managed to connect, but hopefully as we go through, Kirsty will connect. We also hopefully will have two of our students joining us, Michelle and Ray. So far they haven't managed to connect either. We're all working at home at the moment, so connection and IT issues are not that uncommon, but hopefully we'll get through this presentation today without too many issues. So a warm welcome. It would have been much nicer really if we could have seen you on campus. We always really enjoy the open day, meeting you and answering your questions live. But hopefully this will be next best thing and you'll get an answer to all the questions that you may have. The first thing I'd like to say is there is a chat facility if you go to the top bar of Microsoft Teams, and you'll see there's a question and answer. Now what you should do is just, if you have any questions as we go through, please just post them. At the moment, Kirsty, as I said, is not available to answer them, but our colleagues from admissions are in the background as well, and hopefully they'll either answer them if they can, or we'll answer all your questions at the end. Okay, so what I want to do today is just run through, you know, a bit about the university, a bit about the School of Health Sciences and the courses that we offer, and then, you know, some information about sort of how you apply and what our entry requirements are, etc. So hopefully we'll, you know, by the end of the presentation we'll have answered most of the questions that you might have, but as I say, if you don't, please just post them to us. So we absolutely appreciate you currently be thinking of, you know, which university should I ultimately go to? And each university will tell you they're the best and you should come to us. But there's lots of reasons that you should choose the University of Dundee. There are many sort of like ratings and rankings that various bodies do in relation to universities, and every university will sort of give you their facts and figures, but I mean we are really high up in a lot of the ranking tables. So you can see, you know, from just the list I've given here, and this is just some of the rankings that we can share with you, but we are in the top 20 universities in the UK. Now you may think, well, that's not that great a place to be, but there are hundreds of universities in the UK, so to be in the top 20 is actually a very prestigious place to be. And similarly, we're in the top 250 universities in the world. Now there are thousands of universities in the world, so again this is a very prestigious place for our university to be. In terms of the impact, we're in the top 50 for what the impact that the university has in various forums, and we are number 4 in the UK for graduates entering professional occupations, and that's from all disciplines, not just nursing. And you can see we're number 1 in Scotland and number 4 in the UK overall for average satisfaction with students' courses that they've undertaken. That was back in 2019. So there's lots of reasons that you might want to choose University of Dundee. Now, the first thing I wanted to say about our university in relation to nursing is that we have 2 campuses. So we have the city campus, and that's in Dundee itself, and I'll tell you a little bit about that. But we have a second campus where we offer nursing, and that's over in a place called Kirkcaldy in Fife. It's about 35 miles from Dundee, and you can kind of see on the diagram we've given you here, this where we've outlined the red circle, that's where the campus is in Dundee. Now Dundee sits on a river called the River Tay. We're just at the estuary of that river, and you can see the road bridge on the left of the picture there, and that's obviously where the cars go over to Fife, and or at least transport other than trains. And then you can see the rail bridge, that's the one that sort of curves. And the campus sits just maybe a 5-minute walk from the river, and it's right next to the city centre. So it's a very central campus, and it's quite a small confined campus, so it's easy to get about. The other important place you should think, or you should know about, is Ninewells Hospital, which is our big main hospital in Dundee. And when we're teaching our nurses, we often go up there because there's a large clinical skills area up in the hospital, which we use for teaching purposes. I'll say more about that as we go on, and that's about 2.5 miles from the campus. The other thing I should probably say is there are also some residences up at Ninewells that some of our student nurses stay in when they're studying with us. So the main point there is we have the 2 campuses. So the first campus, as I said, is within Dundee itself, and I'm sure if you've been to some of the other talks or sort of areas that you can go to within this open day, you'll have heard more about Dundee and the campus itself. I'm not going to say too much today because we've got lots of other things to talk about. But most importantly, there's lots of organisations that now say that Dundee is a must-visit destination, and I would agree with that. There's been a lot of investment in Dundee over the last few years, and it's actually ongoing. The whole city, or front of the city on the river, has been or is being upgraded, and we have the new V&A, and we've got a lovely sort of waterfront area now that's, as I say, still work ongoing, and it really is a place to visit. This is a picture of Dundee from the other side of the river, looking towards Dundee, and you can see the Law there, which is a sort of an extinct volcanic plug that the city's kind of built round, and it's got a really great situation. And this is a sort of picture of an aerial picture of the campus itself. So the campus has about 12,500 students on campus, but we have a number of, distance learning postgraduate students as well. So the student population sort of is almost double that. The campus, as I said, is near the city centre, so it's very easy to access, the bus station, the train station, and all the facilities that you have in a city centre. Within the campus, as I said, it's a small-ish campus, and everything is in the one area on campus. So the student residences are on campus, the sports facilities are there, there's sort of like world-leading laboratories, research facilities. There's a wonderful library on the Dundee campus that's had a big investment in it recently. And there's also an award-winning student union, which of course as a student is very important. And in fact, the union is one of the surviving unions, because some of the universities, the unions have closed over recent years just because there hasn't been enough use of them. But ours is a very vibrant, popular union that the students use really well. So our other campus is in a town called Kirkcaldy. Now, Kirkcaldy again sits on a river, it's on the River Forth, which is and it's almost right opposite Edinburgh. It's on the other bank of the Forth from Edinburgh, so you can kind of see Edinburgh from Kirkcaldy. It's a much smaller place than Dundee, about a third of the size, and it has a population of about 50,000. It's approximately 27. Well, we usually say probably more like 30, 35 miles actually from Dundee, and it's kind of southwest of Dundee. But if you study at the Kirkcaldy campus, you really wouldn't come to Dundee for any particular reasons, because all of the facilities that students are offered in Dundee are brought to the students in Kirkcaldy as well. So, for example, there's a wonderful library in Kirkcaldy. There, all the teaching facilities, there's a lecture theatre, there's teaching rooms, all your lecturers are on campus in Kirkcaldy, and the facilities, or the services such as disability services, counselling services, etc., all come to Kirkcaldy for the students. So you don't really ever have to come to Dundee if you're studying at Kirkcaldy. The important thing about, or another important thing about the campus is it's a self-contained campus, and it's only, the university only offers nursing at this campus, and we offer adult or mental health nursing at the Kirkcaldy campus. Okay, so it's a different student experience in Kirkcaldy than it is in Dundee. In Dundee, you have all the other students that study at the university doing every other course that the university offers, whereas in Kirkcaldy it's much smaller and it's just offering nursing. But, you know, for some students, that's what the experience that they're looking for. A lot of the students that go to Kirkcaldy campus live local to Kirkcaldy, or in the Fife area, or you may choose Kirkcaldy because it's smaller, it's a more sort of homely family sort of feel to the campus as opposed to what the campus in Dundee offers. But we can give you more information about the different campuses if you want to. And if you are applying, you apply to either Dundee or Kirkcaldy campus. Please don't apply to both, because we would just get in touch with you and say which campus do you want, and you've actually wasted a UCAS entry, because you can't obviously go to the two campuses, so there's no point in applying. So I've given you some facts and figures about the university, and here's some about the School of Health Sciences itself. So one of the things that our students really like about studying with us is the clinical skills facility. Now, I mentioned the facility up at 9 Mills Hospital. It's a purpose-built facility that we share with the School of Medicine. We have a big School of Medicine in Dundee, and they use this facility. So there's a lot of investment being made in this facility. And we also share it with the NHS. So it really has to be up to state of the art, really, because of the function it has for students and staff in 9 Wells. Within Kirkcaldy, it has its own clinical skills area that again has had a lot of investment recently, but there's 2 sort of rooms in Kirkcaldy that are specifically for teaching our student clinical skills. And as I say, it's been, our facilities have been praised. Another thing that's very or we're very proud of is that in the sort of National Student Survey in 2021, now this is a survey that every student that leaves universities are asked to fill in a survey about their time as a student. And we have come out as #1 in the UK for mental health and child nursing provision. So we're very proud of that. And in recent times, we've kind of jumped up in the 2020 Complete University rankings by 22 places. Again, it reflects the quality of our teaching in nursing. I don't want to bore you too much with facts and figures, but importantly for you guys that would come to study with us, 97% of our graduates, which is almost all of them, are in employment after they leave. And those that aren't in employment once they've graduated as a nurse are generally because they've chosen not to. They've maybe, gone to have family or similar. So moving on to sort of more information about the school, etc. I thought I'd introduce our acting dean, or she will be as of the 1st of September. This is Dr. Linda Martindale. So this is the sort of head of our school. Our previous dean has just left, and we're waiting on a new appointment, which probably won't be for another 6 months or so. So this is Linda, and Linda's very approachable and very supportive of our students, and her door will always be open to any of you that will be there studying with us. I'm assuming she'll probably not be in post unless she gets the dean's post. When you, if for those of you that would start in 2022 with us, but just I suppose the important thing is our dean, our previous dean, and hopefully our future dean are always very supportive and very approachable for the students, and will be there, for you should you need them. So why should you choose to study nursing? We appreciate, if you're just thinking of leaving, or you're just leaving school and you're thinking about a future career, or you're maybe thinking about changing your career, you'll maybe be looking at different options, not necessarily just nursing. So why would you want to study nursing? Now, Kirsty and I have both been in nursing a long time. I more or less came into nursing as I left school. I did a year at university doing something else first, and then decided it wasn't for me, and then went on to study a degree in nursing. So I've been in nursing almost lots of years, 40 years maybe, and Kirsty is not far off that. And we stayed in nursing, but our careers have been very different. And I think that's one of the really important things about nursing, is that the career pathway you can take, you know, will be very different for each one of you. There are so many career pathways that you can take. You know, you can work as a clinical nurse, whether that be in a hospital setting or in a community setting. You may choose to do research. You may choose to be a specialist nurse, work in a very specialised area. You may work in schools. You may work in health centres. You may choose to come and, you know, into education, like myself and Kirsty have done, and that's just some of the career options. And, you know, the great thing about nursing is you can change pathways throughout your career, because there are these different options for you. Nursing is now an all-graduate profession. So when you come to study nursing, you have to come to university and you have to get a degree. And then many of our nurses go on to get a higher degree. You know, they'll maybe do an MSc and perhaps a PhD. So it's an academic subject now, nursing, and I think that's really important, because our clinical role as a nurse now is very different to when Kirsty and I started. Now, in recent years, the role has expanded significantly, and we are doing considerably more within our role as a registered nurse than we did when I certainly qualified a number of years ago. And because of that, you need to have, you know, a graduate education so that you can make clinical decisions. You know, you have a sort of good decision sort of pathway in your head. So we sort of place a great emphasis on graduate skills when we're training you to be a graduate nurse. The other very important thing is you can travel across the world. Every country in the world has nurses, and it's very easy to travel and work as a nurse in different countries throughout the world. Most countries will need you to have some experience as a nurse before you can go and work there. So, for example, Australia, you need to have at least 2 years experience as a registered nurse in our country before you can travel to work there. Other countries, they will look for you to an entrance exam, you know, a nursing related exam before they will let you work in their country. But you have the option, you know, that's what I'm trying to say, you know, that you can study really or work across the world with your nurse qualification. So moving on then to the programmes that we offer at the University of Dundee as an undergraduate. Now, we also offer a number of postgraduate nursing courses. We are just focusing on undergraduate nursing today. So we offer adult, child and mental health nursing at the University of Dundee. And as I said earlier, the Fife campus just offers adult and mental health. So if you are applying for child nursing, you have to do it in Dundee. Now, if you are a Scottish student, you know, you live in Scotland, you were born in Scotland, or you've been living in Scotland for the last 3 years, you are likely to be awarded Scottish Government funding. So you get your fees paid, and there is a nurse bursary now, and we'll talk about that more as we go. We have 3 pathways in nursing. So we offer at an undergraduate level a BSc nursing, which is 3 years. An BSc Honours nursing and an MSc in nursing at undergraduate level. They're all 3-year courses. We also have articulation routes from some of our local colleges that some students, if they're doing a particular HNC, can come into year 2 of our BSc course. And of course, we welcome EU and international applicants to study nursing with us. And this year we had an exponential rise in international applications, and hopefully we'll have a number of international students starting with us this September. I just want to say very briefly a little bit about the 3 types of nursing. I'm sure, you know, if you are seriously considering applying for nursing, you'll have done some homework and you'll understand the differences between the different types of nursing. But adult nursing, now at the top of the page, I've shown you the number of places for adult nursing that we had this year. So for starting in September, we have 396 places for adult students. And the figure in brackets is the number of applications that we have per place. So you can see for adult nursing, we had almost 400 applications. We have almost 400 places, and we had 4 times that, the number of applications, so 1,600 applications for adult nursing. Now, adult nurses, and I'm an adult nurse, work with a range of adults, you know, from sort of like 16 years up to 116, with a range of health conditions. Okay, so, you know, you're looking at a spectrum, and a lot of adult nursing, the focus is on older people, because obviously older people are the ones that have more health issues, and older people tend or can have multiple health issues, so they can need quite complex care. As well as caring for people who have health conditions, adult nurses have also got a role to promote wellness and reduce inequalities in health. You know, so they've got a health promotion role as well. Now, one of the important things for me as an adult nurse was working with the number of other professionals that you do in nursing, and that for me was one of the best things, you know, because you worked with doctors, physiotherapists, dietitians, social workers, you name it, you know, and it was a really great sort of multidisciplinary team that you worked within, but you also had really close contact with patients' families, you know, other agencies that people have when they need to have access to when they have health problems. And that for me, as I say, was one of the key things. And I've also already said about the extensive range of career opportunities as an adult nurse. We also, as I said, offer mental health nursing, and we have about 90 places this year. Okay, now 60 of these places are in Tayside, and 30 places are available in Kirkcaldy this year. And we have 6 applicants for every place. Now, mental health nursing is different from or it can be quite different from adult nursing, although, of course, people with mental health issues also have physical health problems. So you have to have an understanding of physical health issues as well as mental health issues. But whereas as adult nurses, you know, would be looking after the physical problems and trying to, you know, diagnose and manage nursing issues related to things like diabetes, coronary heart disease, you know, dementias, etc. Mental health, the main focus is on, you know, trying to help people with mental health problems and move them forward from a place of mental health disorder to mental health, you know, mental health wellness, I suppose. And our mental health team, which is a small teaching team in mental health, and they talk about sort of the 3 values within mental health nursing: compassion, commitment, and curiosity. And they say, you know, that good mental health nurses need to have all these qualities, I suppose, to be good at what they do. We also offer children and young people's nursing, and this year we had 56 places, but you can see that there are a considerable number more applications for children's nursing than there are for any other type of nursing. And that's unfortunate that a lot of people who apply for children's nursing are disappointed. And it's not just with us in Dundee, any university that offers child nursing has the same problem. It's a different type of nursing in that children generally don't become unwell, and if they are unwell, they'll go to the GP with their parents, and they'll usually get a sort of remedy from the GP, and they'll move on to wellness quite quickly again. So children, when you're looking after them as a children's nurse, tend to be iller. Okay, and one of the big factors is trying to minimise the or the problems that a child illness causes for the child and the parents. So you focus initially when you're learning about children's nursing on the healthy child, and then you move to ill health and, you know, minimising the impact of that ill health. Children are different because as an adult nurse, I'm able to say to people, you know, how does that pain feel? How does your illness make you feel, and what makes you feel better? How long have you had it? And it's easy for adults to answer questions generally, but with children it's not, you know, so you have to kind of come down to their level and get information from them in different ways. And one of the big things about working with children is, of course, any ill child comes with a very anxious family, you know, whether that be mum, dad, granny, and I know that from I am a granny now, and I know that from my perspective, you know, you as a granny, you worry about your children or your grandchildren the same way their parents would. So you've got to work with the sort of bigger family widely when you're a child nurse. Now, new to us this year is another qualification that we're offering, and it's called, we call it a dual qualification. And this year, for the first time in September, we are starting 10 students who are doing a joint qualification in child and mental health nursing. Okay. Now, you can apply for this new dual qualification if you are applying for BSc Honours or MSc. And when you apply via UCAS, and there is a specific UCAS code for this new programme that we are offering. Now, I told you our other courses are 3 years. This is a 4-year course. Okay, so what you do is you either start in the child field or the mental health field, and you do your initial qualification in the 3 years, and then for the 4th year you will do theory and placements related to the other type of nursing that you haven't already got your qualification in. Okay, so hopefully that makes sense. So you study either child or mental health to start with, and then in the 4th year you do the other fields qualification as well. But it is a continuous 4-year course that you have to undertake. And if you're a Scottish student, you will be funded for the 4 years. Now, the reason that this course came about is that there is a wide recognition that when children have mental health problems, in the past, they were looked after by mental health nurses. Children's nurses couldn't, you know, input into their care. And it was recognised that, you know, children and adolescents, if they have mental health issues, really need the services and the support of children's nurses as well. So this is a joint qualification that Scottish Government are funding to allow us to produce nurses who will, you know, be able to meet the needs from mental health and a child perspective for children with mental health issues. And as a result, the employability of these nurses is very good. And so far, we've had an awful lot of interest in this new course. So I just want to briefly outline, and just have a check of the time, briefly outline the qualifications. Now, you'll get all this information online if you go to the university website as well. So if you're studying the BSc, or you're wanting to apply for the BSc nursing, if you're looking to apply for adult or mental health, what we look for are 5 subjects, and 3 of these subjects have to be at higher. So you need to be able to achieve a B and 2 Cs at higher, but you also have to have English and maths, but then they have to be at a minimum of National 5 level. Now this year, or for next year's entry, we have just put up the child qualifications, and it's not reflected on the website yet because I just went in to check that today, but we will for next year be looking for anybody applying for child nursing who are coming with Scottish school qualifications to have 4 higher, BB and 2 Cs. Okay, and we will also look to give preference to those of you that have a science subject related to nursing. Okay, now the science subjects that we would prefer are chemistry, biology, human biology, PE and psychology. Okay, A-level, we're looking for 2 Cs, but again, you need to have 5 subjects, but 2 of them at A-level at 2 Cs. And probably, and this hasn't been firmly decided yet, but if you're applying for child, we will probably be looking for B and 2 Cs at A-level. We also accept Irish Leaving Certificate qualifications, and you can see there what we would be looking for. And if you are in Ireland again and you're doing a QQI qualification, a level 5 nursing studies qualification, you can see there that we're looking for you to achieve all 8 modules, but 5 of them at distinction. Okay, and the distinctions must include your 3 core modules. We also accept equivalencies such as access courses, HNC courses, etc. But if you've got any specific queries about qualifications, you can maybe pop it in the chat facility. But you must have English and maths, at least National 5 or equivalent. But what we don't do now is if you don't have maths, we won't reject your application. We will give you ways of achieving maths, because there's a couple of options. You know, there's a couple of online courses that you can do that we will accept, and we'll give you information about them if you apply to us without maths. If you want to do the honours course, you need to have 4 Bs at higher and BB at advanced higher. Now, the reason that these are such high qualifications to get into our BSc honours is that it's a 3-year honours course, not a 4 years. Okay, so you have to come with the equivalency of 1 year at university already for you to get an honours degree, and that's why it's so high. If you're applying with A levels, you need to have 3 Bs. Okay, and again, we accept equivalencies. You can see there, but again, you must have English and maths. If you are interested in doing our 3-year MSc at undergraduate level, you have to come with a degree already. Okay, so we don't specify what type of degree, and it can be an ordinary degree, but you also must have a maths qualification. So that's just briefly the minimum entry requirements. As I say, if there's anything specific, you could pop it in the chat and we can try and answer it for you. We thought we'd give you a sort of an idea of what your nursing year would look like. Now, this is what we call the flow chart, and this is for the students who'll start this year. We don't have one ready yet, obviously, for the students that would start in 2022, but it's just giving you a rough idea. Now, this year, this isn't exactly right because the students are now starting a bit later. So this is what a timeline here from September this year until September next year for the students. But importantly on this, it outlines, you know, when your holidays are and how the course is structured. And you can see the sort of purpley and green boxes are modules, theory modules. So generally, when the students start with us in September, if they start as planned, early September, you get a week's holiday in October. The students this year are not starting. We've had to postpone the start of the semester because of COVID. They're not starting until the 27th of September. However, so as a result, this annual leave week in October has been cancelled. But in a normal year, you'll have a block of theory, then you'll have a week's holiday in October, and then you'll have another block of theory at university. And then you'll have a Christmas holiday. The red are the holidays, as I said. So you get 3 weeks holiday at Christmas. Then you come back to your first practice block. So that's out in clinical placement. And that's a 6-week block of placement. You then come back to university in February and you do more theory. Okay, again, with a holiday in the middle of it for Easter, a week's holiday. At the end of this theory block, you go out to practice for another 6 weeks. Okay. You come back and you do a student selected module. Now, what this is again, it's theory, but you choose the module that you want to undertake. So there's a range of modules that you can choose from, and you undertake your chosen module in this block here before you have your summer holiday. Your summer holiday consists of 4 weeks annual leave, and then you come back to practice for a final 6 weeks before you move into year 2. Okay, so you can see the course is structured. You do a block of theory, a block of placement, block of theory, etc. And that goes for the whole 3 years of the course. Some key features. I'm aware I've been talking for quite a long time, and I don't want to bore you too much, so just very briefly run through some key features. Because nursing there are a lot of similarities in sort of professional knowledge and sort of clinical knowledge that you need, irrespective of whether you're doing adult mental health or child nursing. So there's shared modules that all our students do or undertake, and there are field modules that only you only study, you know, for your specific field. Okay. There are also things that we do within the 3 years of the course that are interprofessional. And as I said, one of the key things for me was working with the other professions when I was in clinical practice. And so you have to sort of start building up relationships, and we do that at an undergraduate level. So some of the teaching we do is with other disciplines, you know, the medical students, sometimes social work students, sometimes dental students, and we call that interprofessional education. Now, in normal non-COVID times, we have international placement opportunities. All our students are given the option of applying for a student placement abroad. Okay, we haven't been able to offer them obviously for the last 2 years, but hopefully, you know, by the time you guys start with us, we will be able to offer international placements again. And we have placements in Germany, Austria, Finland, Australia, Lithuania, and we're trying to develop our sort of international placement areas all the time. I talked a bit at the beginning about our clinical skills centres. Now, one of the key things that we have or we do there, as well as teaching you the skills of nursing, you know, how to do a blood pressure, how to take someone's temperature, how to resuscitate someone, we also have what we call simulated practice. And this is when we bring people in who act as patients for us, and we run scenarios. So we have, for example, a diabetic scenario, we have a dementia scenario, where we get the students to act as nurses looking after people who have specific conditions, you know, in clinical areas. And so it helps prepare them for going out to clinical practice, where they will meet these very situations that we try to teach you about in our simulated practice. I mentioned at the beginning about the emphasis on graduate and graduate skills, you know, the way you think, the way you try to make decisions, etc. And we place a great emphasis on that, so you will be a good clinical nurse, good clinical decision-making professional, you know, in your approach and your thinking processes. We have a very strong and influential research division within the School of Health Sciences. We have a number of researchers that, and their work impacts or influences our curriculum, and they, you know, will teach on, the researchers teach our student nurses about their research that they're doing. And a number of our lecturers and wider university staff have had awards for their approaches to teaching. I mentioned about our clinical skills areas, and the area you see here at the top of the picture is in Nine Wells Hospital, and part of it is built like a ward. So we have a 6-bedded clinical skills ward that simulates a real ward in Nine Wells Hospital, and you can see a number of our students here undertaking one of the simulated practice exercises that I talked about. So as I said, we take you up there for a number of sessions over the 3 years. Here's somebody doing a blood pressure on one of our simulated patients. We sort of teach you, as I said, you know, about resuscitation. We teach you how to give bed baths, how to give injections, you know, etc. And in Kirkcaldy, we have a similar area. It's not quite as big, but it's similar. It's built like a ward area, and we do a lot of clinical skills teaching within that area. A little bit about the placements then. Now, obviously, if you're based in Kirkcaldy, your placement area is going to be different than if you're placed in Dundee. So let's focus on the Kirkcaldy placement area. I've already said that half of the course is placement based. Okay, so half theory, half is out in placement. And if you are situated at the Fife campus, your placements will be across Fife. And similarly, if you're situated in Dundee, your placement area is Tayside. Now, obviously, the placements that you undertake are related to the type of nursing that you're doing. So if you're doing adult nursing, your placements will be related to adults. And if you do mental health, it will be mental health placements. And we do try over the 3 years of the course to give you a broad range of placement areas related to the field of nursing that you're undertaking. So you may be hospital based, and there's a number of placements within hospitals, in medical, surgical, theatre, specialist areas. Specialist nurses work in hospital. There are a number of placements with them. You may work out in the community. You may work in nursing care homes where older people live. So there are a number of placement areas that you will be placed over the 3 years. A lot of them are quite innovative. We've looked for different types of placement areas that we can let our students access, mainly because we have a lot of students and we need to have a lot of placement areas, but it does mean that there's a lot of very interesting placements that you can go to. The placements are not all necessarily right on your doorstep, and that's an important thing for me to say here. If you're based in Dundee, you won't have all your placements in Dundee itself. You may have to travel a bit further afield, and similarly, if you're based in Kirkcaldy, you won't have all your placements in Kirkcaldy. So you may, for example, have to travel 20 miles, up to Perth, or from Kirkcaldy to Dunfermline for your placements, but they're all on bus routes. Okay, so any placement we expect you to go to is on a bus route for you. When you go out to placement as a student nurse, you will be allocated supervisors and you'll be allocated a placement assessor. And they obviously are there to support your learning, make sure you meet your learning objectives, give you the opportunities, to or expose you to all the different situations within that placement so that you get a broad range of experience. And the assessor is the person who at the end of the placement will write an assessment of your performance in that placement. So you're well looked after in placement, okay? And we pride ourselves on the support that the students do get when they're in placement. When you go to placement, you have to just work the shift pattern of the area that you're going to work in. If you go to Kirkcaldy Hospital, for example, in Fife, or in Kirkcaldy, or Ninemills Hospital in Dundee, and you're on a surgical ward, you may be doing 12-hour shifts, which includes some weekend work, or you may be doing a sort of short shift pattern, where you do lates and earlies. Again, you would have weekend work to do. Or you may, if you go out to the community, be working Monday to Friday, 9 to 5. Okay, so you just have to take on the shift pattern. But that's good because it exposes you to all the different times of day that people need healthcare. As I said, you may have to travel to some of your placements. When you're in placement, you're given a big document to take with you, and that you use that for the 3 years, and that sort of supports your learning in placement. So your supervisors and your assessors use this document to see what are your learning objectives for that placement, and that's what they write your assessment and whatnot in. So it's an essential document that you have to take great care of because you'll use it for your 3 years when you go out to placement. I think importantly, when you're moving away from home or you're studying, at the university in your own city, it's important that you have the right support. It can be really challenging coming to university, particularly if you haven't studied for a long time, or you've just left school and you're really worried about coming to university. Will I cope with the level of study? Because it is very different probably from what you've done before. But I want to reassure you, there is an enormous amount of support available for students at the University of Dundee. One of the key things is that you are all allocated an advisor of studies, okay? And at the university or at the School of Health Sciences, we put you in little groups of about 20 to 30 students, and you sometimes are taught in that little group. So for example, when you go up to clinical skills, to do sessions up there, you go up in that little team of 20 to 30 students. But that team is allocated an advisor of studies. And if you are an adult student, it would be somebody like myself or Kirsty that's allocated to you as your advisor of studies. Now, I have just just seen a group of students through 3 years. My group of students are just literally finishing off their final placement and are just about to become newly qualified nurses. And I've been with them since first year, and I've got to know them really well, and they've got to know me, and I'm there for them if they have any difficulties, whether that be, you know, personal difficulties or academic difficulties. I'm there as their first port of call. And I've dealt with a number of student issues over the 3 years. And as I say, I've built up a really strong relationship with my students, and I'm actually feeling really sad that they're just all about to finish. It's great to see them graduating and moving on to their new careers, but I feel a bit sad. So that's your first sort of support mechanism. But there are a number of other support mechanisms, and I don't really want to go through them all. I'll maybe just let you have a wee read of them. One of the key ones maybe is the disability service. So for those of you that are listening that maybe have a disability, you know, whether that be a physical disability or a learning disability, you know, something like dyslexia, there is a very, very good disability service. And they will offer you an appointment, and they will do a one-to-one assessment of your needs. And, you know, for example, if you did have dyslexia, there are a number of mechanisms that can be put in place, you know, from giving you IT equipment to programs for your computer, to having scribes and exams to get an extra time, etc. There are a number of support mechanisms that they can look at, and it really depends on your individual need. Another sort of key one I think on that list is the last one, the academic skills support. There is a department within the university that if you're struggling academically, so if you're just having difficulty writing essays or studying for exams, you can get one-to-one support from a member of the academic skills team in the university to help you. And a lot of our students use this that support service. And the great thing about support at the university, there is a kind of one-stop shop called the Inquiry Centre. So it's like a shop, and it's right beside the union. And if you feel you need some information or support, you can just go into this shop and tell them what you're needing, and they will put you in touch with somebody. So you don't even have to do the research yourself. You can just go in and ask for help, and they can put you in touch with who you need to speak to. Importantly, social life as a student. I've already mentioned the union in Dundee, which is an absolutely wonderful union. The staff use it as well as the students. You know, it's got coffee bars, it's got restaurants, it's got, you know, it puts things on at night, it puts things on, you know, when there are big social, sports events going on, you know, they'll have big large screen TVs that you can go into. But in sort of Dundee, in its wider sense, you know, because it's near the city centre and it is a very big student city, there's lots of nightlife going on in Dundee. There's also lots of shopping, and there's lots of other things that go on. You know, this is just some of them, but I'll let you can have a look through that yourself. Lots of lovely pubs, restaurants, you know, as you would expect in a busy, vibrant city. A little bit about the funding. If you're a Scottish student, as I said, there is a bursary, a SAS bursary available to you, and it's at the moment £10,000 a year, and you get that every year, and it's non-means tested. Okay, but one thing we do ask is if you have studied nursing before and had SAS funding before, we ask you to write it on your application form so that we know. Okay, if you're a non-Scottish student, you really need to check out with your own award agency in the country, you know, whether it be England, you know, Northern Ireland, Wales, Ireland itself, or if you're international, you would have to get funding from your own local agencies. If you do come from one of our other partner countries in the UK, Northern Ireland, Wales or England, we do have a scholarship that's automatically awarded to you of £2,250 a year. Okay, and it does go a little bit to help you pay your fees, etc. I thought I would just end really in saying a bit about studying with us in terms of COVID. Because obviously that's going to be a big concern. And the university, as I say, we've all been working at home for the last, well, 18 months now, but we are starting to move back to campus. And, you know, I think I can honestly say the university have done a sterling job of making sure everybody has been safe, and that your safety when you come to study with us is their absolute priority, and I can honestly say that hand on heart. So currently, anybody who's coming, and to residences and they need to self-isolate, particularly if you're coming from another country, you'll be given residences free of charge while you're self-isolating. All the residences on campus are single occupancy, and you have an ensuite room. So, you can contain yourself if you need to. There is a student health service that you can get advice and support from. And when you do start with us, there will be a mixture of online and face-to-face teaching, and it will be done under strict regulations, so it's a 1 metre distancing. You have to wear your mask when you're walking about, buildings, and you have to wear it when you're sitting in lectures or tutorial rooms. Okay. And there's lots of sanitisers, face masks, etc. available to you. So just to be reassured, we do take your safety seriously. Almost finished. You need to apply via UCAS, and UCAS opens early September. It's the 5th or 6th of September for applications for next year, and it closes, as you see there, on the 15th of January. So you can apply any time after the beginning of September until the 15th of January. We do place a bit of importance on your personal statement because that's the main way we can assess you. We don't know you. We have we have probably sort of like 2,500 applications come in. So your statement is really important. So put some work into developing that well. Once all our applications come in, we shortlist and we do start our interviewing between December and March. Okay. There is the admissions. We have a sort of generic admissions email account. That's the email account there, and any emails that come into it, the admissions team within the School of Health Sciences answer that. So generally it's myself or Kirsty that would answer your queries. If you want to take a little note of that, we can perhaps put it up at the end again. But I'm not entirely sure because I've been online with you guys. Oh, Michelle's here. I can see Michelle online. So we have Michelle with us. Michelle's one of our students. Hopefully Michelle won't mind just saying a little bit about our student experience. And Michelle, are you there? Michelle, do you want to come online? Kirsty,
Michelle was there. Yeah,
oh,
Michelle was there a minute ago.
I'm going to take my presentation off so you can see Michelle. I'll let you just... Michelle, are you there?
Yes, I'm here. Can you hear me?
Yes, I can indeed. Yeah. Michelle, do you want to say a little bit then about your experience as a student and any advice you'd give to anybody that was thinking of applying?
Oh, well, what advice would I give to you? So obviously this year's, not been the year that anybody expected. But, like what you're saying, Arlene, there's plenty support from the university in terms of academically and, otherwise, which, a lot of students have needed support this year because it's been quite isolating working from home. And but yeah, hopefully for our new students coming in, they'll have a different experience that hopefully we're going to have for second year where we're on campus a bit more. And but yeah, I certainly think that, obviously I can only speak from my own experience, but I've felt that there's always someone that's there, even though we're not seeing people in person. I've found it quite easy to access support, or whether it's from academic skills or from our advisory studies, or so. Yeah, it's been a good year. It's been different to what I expected. But it's still been enjoyable, and I'm certainly looking forward to getting onto campus and getting that all-round experience, especially for the clinical skills.
And what type of nursing are you doing, Michelle?
So I'm doing adult nursing.
And you're based over in Kirkcaldy, aren't you?
I'm in the Kirkcaldy campus, yeah. yeah, unfortunately, Roy, who's from our Tayside campus, has not had, I think he's been having some technical issues today, so he's not been able to join us, unfortunately.
Yeah.
So yeah, I'm at the Kirkcaldy campus, which is obviously a different experience again to what the Dundee students, but certainly, you know, we've got a great wee campus at Kirkcaldy when we get on it.
Yeah, it's a lovely campus in Kirkcaldy, isn't it? And it's a very friendly, you know, homely feel about it, isn't it?
Yeah. So, and I think because obviously we have smaller numbers, then students, not so much this year again because of COVID and doing everything online, but you know, we tend to build closer relationships maybe and get to know each other a bit better because there's fewer of us. So.
And what sort of placements, just finally, Michelle, have you had during your placement blocks?
So I'm on placement at the moment in outpatients at the Queen Margaret Hospital, which is, this is only my second placement. So my last placement I was in health visiting. At the start of January, I should have been out on placement in elective orthopaedics, but it wasn't elective orthopaedics, obviously, due to COVID, that wasn't running. So, but my husband was high risk, so I opted out of that placement. So, yeah, but at the moment I'm in outpatients at Queen Margaret, which, do you know, it's not busy like a ward situation, but because there's lots of different clinics, you're getting, you know, I've been sitting in the different consultants, so you're getting to get a little bit of information about lots of different areas, which is interesting, especially if you don't know what area of nursing you want to work in. You know, you're getting a little bit, like today I was in with the cardiologists and the TIA clinic, and I've been in with the orthopaedic consultants or with the urogynae consultants, you know, so you're getting a good range of different experiences. So
marvellous, yeah, and that is what great. You know, I think when you're in clinical placement, people really do make an effort with the students, don't they, to give them a good experience and you know, expose them to different learning opportunities, don't they?
Yeah, definitely. And you know, I've been in day surgery and I've been in theatre and you know, within this placement. So yeah, it's really good. There's lots of different lots of opportunities there. You just need to ask for them, and you know, and they're there. Not as so. Yeah. Good.
Wonderful. Okay, thank you very much, Michelle. I'm just very aware of the time. You know, that's 6 o'clock. So we've kind of just drawn this session to a close just now. But I mean, you can still. But with this, we won't close. You know, sort of end the session. So if there's any more questions that you want to ask, please just
write them in the question and answer. And I'm just typing away at the moment, so trying to answer them all.
Yeah, I'm just putting the email address. Somebody's asked about the email address. Is there any questions, Kirsty? Oh, I can't get it to post. Is there any
No,
questions?
there was one question which I couldn't answer. So the 3 core modules you have to do if you're studying BTEC subjects. Do you know what? Is there specifics? I have not had that question before.
I'm just trying to think off the top of my head, Kirsty. I can't remember them. It's the core modules. I can look it up online, but if you are studying the QQI qualification, you'll be able to. You could ask, you know, at your college, what are the core units? You should know what the core units are. You're generally told them. I just can't remember off the top of my head. Okay, so I think there have been some questions come in, so you're able to sort of like just read the answers to them. But I'm just about to post the email address. Okay, so if you've got any questions after today that you haven't had answered or you think about them later, please just email us, okay, and we'll make an effort to answer them for you. So thank you so much. It's been quite a long presentation. I didn't think it would take that long, so I do apologise a bit. So thank you for being with us, and hopefully that's been informative for you.